Hi, sir. How are you?
Hi, how are you?
I'm well, thank you. My name is Elise Kiyuna, and I'm from Vaccinate You.
Oh, nice to meet you, Elise. My name is Adrian. I'm the college president of HST Community College. How are you doing today?
I'm well, thank you. Thank you for meeting with me.
Yeah, as a college president of HST College, we're a small community college in Hawaii with approximately a student body of about 6,000. Most of our students are from the minority rural community in Hawaii. And my role as president is to review processes and programs that affect the student body.
Perfect. Well, let me tell you a little bit about our organization. So, it is called Vaccinate You.
Mhm.
It's a nonprofit organization that targets university and college students with the goal of promoting and administering the HPV vaccine. What do you know about HPV, sir?
Um, my perceptions and my knowledge of HPV are pretty basic. As an administrator, I know that it's a sexually transmitted disease. I know there's no cure, and I've heard that it can lead to long-term health problems like I think cancers, maybe like later in life if it's not treated. Um, and I know there's a vaccine I think that came out in the last 10 years or so.
Perfect. Sounds like you have a good basis of it. So, a little bit about us and then a little bit more about HPV. So, our organization would like to talk to you about having your college host us so that we can bring our program to your students. Just a little bit about HPV. It's also known as human papillomavirus. It's an extremely common viral infection. It is spread through sexual contact. It's estimated that 79 million Americans are infected with it, and it can lead to certain cancers like cervical, vulvar, penile, anal, oral throat cancer. So, and as you said, there's no cure, there's only treatments for these problems. But one way we can help is to get people vaccinated. The vaccine on the market right now, they actually boast almost 100% efficacy against those high risk strains that could lead to cancers. So the current recommendations right now are from 9 to 45 years of age.
Mm.
And I know that we aren't targeting that, that recommended 9 years of age with our vaccine by coming to you. However, we do have a branch of our organization that targets seventh graders, so we can hit that demographic. But we found that we hit a barrier with parental refusal. So we provide tons of education, but we still get some resistance. So we found that by coming to the college levels, we can combat that disparity by reaching out to students at the college level where they no longer need parental consent or contribution for the vaccines. The CDC reports that sexual age for males and females is roughly about 17 years of age. So we know we're hitting them a little late. We figure better late than never. And also, we're hoping to educate them in the hopes that future generations will be benefited.
Hmm.
Can you tell me about what the current HPV culture is on your campus?
Well, honestly, I'm not too familiar about any specific HPV culture on campus. We have a small student health clinic that refers students to outside medical community health partners if they need like services that we can't accommodate, like vaccines and travel vaccines and such. Um, but I don't know any specific culture per se specific for HPV.
Okay. Um, Anything about budgeting and stuff?
um, well, currently, our budget's pretty small. Like I said, we're a pretty small community college. Our um, our current clinic right now it's a small health clinic with a medical director who's been around a long time, and then also two nurse practitioners, two part-time LPNs, and and a few medical assistants that rotate. Typically, our medical assistant and the services we provide is mostly basic prevention. Condoms and minor aches and ailments. Anything more serious, we send people out mostly to community health partners, and typically every year we have a flu shot clinic or a flu shot like a drive, I'm supposed to say,
Mhm. Got
and
it.
and that's pretty much most of the health clinic scope and what we do.
Well, the only reason I ask is because one of the things that studies have shown is that some providers don't recommend the HPV vaccine because they're uncomfortable. So one
Mhm.
of the things that our organization does is we actually send trained staff into your college. We would work with your providers and we would get them comfortable about talking about things like HPV, sex, the vaccine, just so that we can get them to promote it a lot better.
I see. Well, my major concerns, honestly, as a hospital administrator, is how will this be paid for? You know, we have a pretty small budget. Even like anything major that we have come up, it's staffing can be kind of an issue sometimes, especially during the busy times of the year, where I just don't have the staff that could accommodate some kind of major like HPV vaccine drive.
Yeah, I completely understand. And that is a good question. So we actually conduct the health fairs and the immunization drives. We would have our volunteers start posting flyers around campus to promote the events roughly about 3 to 4 weeks in advance. We would also love your support by with the college paper and then PR representatives so we can get some online exposure. And we also do utilize free platforms like TikTok, Facebook, Twitter, Instagram, things that don't cost anything so we can get the word out. And our organization, our funding comes from the general public, from government grants, and also private foundations. So we're also worried about funding as well. Yeah.
In terms of like logistics wise, will you guys provide the materials? I know, like, you know, we have some brochures in our health clinic, you know, for basic things, but you know, we don't have any of that supplies and tents. We have like one tent for the health clinic. You know, we don't have any of the logistical things. There's logistical challenges I can see for coming up right away, just because we're such a small community college.
Yeah.
Will you guys provide all that?
Yes, we have tents, supplies, volunteers that love working with us. We have paid staff members that come on the day of the events. The vaccines are paid for with our funds, or if we're lucky, they're actually donated from the drug company themselves. So we should be good. It's first come, first serve. So we do like to get people going early, and hopefully we have enough product to go around.
I see. I see. Um, I have to ask, of course, because that's always in the back of my mind. What are the institution's liabilities? You know, if anything happens, is there protocols set in place for, you know, medical emergencies? Like, what's to do with all that?
Another good question. So first off, let me start by saying we are not forcing anyone to get vaccinated. This is volunteer. We provide education. We do make people sign consent forms before administration. And so that's covered there. In the event of an emergency or adverse reaction, we do have AEDs, and all of our staff and volunteers are basic life support certified. We simply come, provide education and the means for them to get the shot. And we tell them when their follow-up is due, because it is a set of 3 shots. And then we're just passionate about giving young adults that were not able to get the vaccine when they were children a chance to get it. There's a disparity sometimes of them not being able to get the shot, whether it be socioeconomical status purposes that led to decreased access of care or parental barriers. We just want to make sure that we can be a resource for them and provide education and hopefully a vaccine.
Yeah, I agree. There's definitely a need for that. Unfortunately, sometimes my hands are tied and we're a little limited in our scope here just because we're such a small rural community college. I know that some of our student body would benefit from this kind of health promotion, and a lot of them just don't have the knowledge base behind it. Unfortunately, it just kind of comes with par for the course for this area of Hawaii. Can you tell me what other benefits my student body would have? I guess I can hear your points, but I'm.
Well, definitely immunization. That's our priority. Education. Hopefully, by getting immunized, they're decreasing the chance of getting HPV-related cancers later on in their lives. And also another perk is a chance to be in our studies. We do enroll students if they are willing to enroll in our studies so that we can check them 2 years out, 5 years out, and 10 years, and so on to see, did we make an impact? Have they gotten HPV related cancers? I know I like studies, a lot of people do. Some students really, really love being a part of, you know, kind of the numbers. So it's good.
It's all about the data.
Yeah.
Well, I'm interested. You know, you've appeased my worries and my concerns. So I'll definitely reach out to my secretary and my health clinic medical director to reach out to you, and we can see if we can make next steps happen. I know that we have a student recess coming up, but I think after that we could easily talk about implementation and the time frame coming up. So I'm excited to work with you. Thank you very much for reaching out.
Thank you for meeting with me. That would be perfect. I'm so excited to hopefully bring our program to your campus.
Thank you so much for your time.
Of course. Have a good day, sir. Bye.